Today we have with us Dr. Saurabh Joshi. He's a vascular interventional radiologist at the Vein Center, which is a world-renowned center for treating varicose veins. He has won the Venatus Zurich Award and the College of Phlebology London Award for newer techniques. He has had many presentations and papers to his credit. Not only is he a warm and a nice person, he has developed innovative techniques like the glue and foam technique. Dr. Saurabh is among the world leaders in treating varicose veins. He has developed innovative techniques like the plug and foam technique. He's also developed techniques for treating recurrent ulcers and non-healing ulcers in the elderly. So glad to have you, Dr. Saurabh.
Thank you for the introduction, ma'am.
Dr. Saurabh, what are these varicose veins?
Varicose veins are the bulging blue varicose veins on people's legs. These can be seen on the thighs, calves, and even on the feet. Varicose veins also cause skin darkening, swelling, and open wounds on the legs, which takes a long time to heal.
How common is this condition, and what kind of people tend to get these varicose veins?
These can be seen in patients who have to stand for a long period of time, those who are working in marketing, or even sailors or people in the hotel industry. Also seen commonly in women with 2 or more than 2 children. Varicose veins is also very common in the elderly. It is the #1 cause of non-healing wounds on the legs in people over the age of 65.
Dr. Saurabh, why do these veins become varicose, and why do they bulge?
So our veins have these valves in them. Now, a valve is like a valve of a tap, where if you open the tap, water flows. You stop the tap, water stops. Similar valves are there in our veins, which close and open when we breathe in and breathe out. So in the normal activities, like when we are walking, our muscles are moving, the blood from the legs in the superficial venous system gets pumped towards the heart. Now, in some patients who have genetically weak valves, these valves don't pump properly. So blood, instead of going upwards from the legs towards the heart, tends to get stagnated in the legs because of gravity. And as the stagnation increases, we see that the veins keep on bulging out, becoming bigger and bigger, and start depositing blood products underneath the skin, thus leading to the swelling, skin darkening, and progressively weakening skin, which breaks open and causes wounds.
That is interesting. So how do we diagnose varicose veins?
Yes, so as we said before, varicose veins is very visual condition. So clinically, it is not too difficult to identify varicose veins. When a patient walks in, we can see by the time the patient is walking in, we can take a look at the legs and get a very good guess that the patient might be having varicose veins. Other than the clinical findings or the visible findings, the gold standard for diagnosing varicose veins is an ultrasound examination. So this is a sonography of the legs, also called a color Doppler ultrasound, in which we see the size of the veins, the functioning of the valves of the veins, the arrangement or the mapping of the veins, and this is the current best way worldwide to diagnose varicose veins. Now, we at all our centers have a ultrasound enabled OPDs, where all our doctors, they do the ultrasound at the time of the consultation. Thus, we have a foolproof diagnosis of varicose veins, and which can be treated according to the diagnosis. Now, other than that, a color Doppler examination also helps us look for other diseases of the veins. This can be deep vein thrombosis, which is clotting in the veins, a superficial venous thrombosis, which is again clotting in the superficial venous system, inflammation of the veins called as thrombophlebitis, or even a condition called deep venous reflux, where this is the non-functioning valves in the deep venous system. All these, whether the patient has this or not, or are there any clots or not, it has an implication on how we treat the patient. It is other than varicose veins, we have to treat the patient holistically. So if you have something else, we can then tailor the treatment accordingly.
I like that, treating holistically. But let's talk about the treatment. How are varicose veins treated?
So varicose veins have been treated by various ways traditionally since a long time. In the olden days, in the 1990s or before that, there were the open surgical methods. The open surgical methods were called the surgical stripping or the ligation, in which these veins were physically either removed or tied. This was an open surgery, and it required a full anesthesia, lots of stitches, dressings, and then a lot of downtime. But these are things of the past. Now procedures are done through a pinhole. Pinhole it means putting an IV line needle. So if we have seen somebody with a saline being put on the arm, the procedures are done through such a small IV line needle. These two are now very much advanced. A little bit older way of treating varicose veins was the thermal ablation. Thermal ablation means simply heating and burning those veins. These were by laser ablation or the radiofrequency ablation. These, although being done through a small pinhole, they had their limitations where it used to hurt. So if you are doing burning the vein up to 100 degrees from the ankle up to the hip, it would hurt the patient, and they would require some type of anesthesia, either a spinal anesthesia or a general anesthesia. In addition to that, we had to inject a lot of fluid around the veins so that we protect the surrounding tissues, the nerves don't get burned, the muscles and the skin don't get burned. So this was minimally invasive, but it required a longer recovery, and it was a procedure in which anesthesia was required. The ablation procedures, the thermal ablation procedures of radio and radiofrequency ablation or laser, they do require the patient to wear stockings compulsorily. These are heavily dependent on stockings. But again, these were probably until the early 2000s, 2015, 2017-ish. But now the world has moved forward. The current best ways of treating varicose veins do not even require heat. So we do this through a pinhole and IV line needle, but there is no need to burn the vein. This is called non-thermal ablation, and the current standard of care for treating varicose veins by non-thermal ablation is a procedure called VenaSeal. VenaSeal. We are sealing the vein by using a particular kind of medical glue. Now, because there is no heat involved, we do not need to make the patient unconscious. The patients need not be given spinal anesthesia as well, and we can reduce the fluid load. So in a sense, we are not injecting the fluid which is given to protect the from burning, and that has actually helped us to treat much older patients, or patients who are unfit for anesthesia, patients who have cannot otherwise be given any sort of invasive treatment.
So let me get this right. The thermal ablation will cause thermal damage to the tissues. Is that what you're saying?
Yes, the thermal ablation was in a sense burning the veins,
Right.
and to keep that burning limited to the veins, we had to inject a fluid around the veins,
Right.
so that we are insulating the other tissues from
Right.
burning,
Right.
and this was a way to protect the other tissues. But now what happened is, when we are burning, there are some nerves, especially below the knees, the saphenous nerve, the sural nerve on the back of the calf. Now this was a limitation of thermal ablation, where either you could not treat those, or the patient, if you treated those, then the patient had a risk of developing a neuropathy. Neuropathy means a loss of sensations around the feet, altered sensations, tingling, numbness, burning around the feet. But in the newer procedures where we do not need to burn, the neuropathy goes. There is no question of neuropathy because we are not burning.
Dr. Saurabh, what is the difference between VenaSeal and laser?
So the primary difference between VenaSeal and laser is the closing method. The closing method with laser is heat, where we burn the veins and we close the veins by compressing them with stockings. With VenaSeal, the primary closing method is the glue which we inject. So this is an adhesive which we inject inside the veins, and when we press it, and it seals from the inside. Other than that, the requirement for the local anesthesia, which is also called tumescent anesthesia. In laser, the tumescent anesthesia is compulsory, where we have to give multiple pricks and give a lot of fluid inside, and in VenaSeal we do not need any of that. Other than that, the at-risk patients. Now, if we are looking at patients who are the elderly, or patients who have other issues like blood pressure, diabetes, or those who are taking blood thinners, laser becomes a little difficult because they are also not candidates for anesthesia, and spinal or a general anesthesia would be a little risky. In these patients, because we are not giving any excess pain and we don't need to give them anesthesia, VenaSeal becomes the treatment of choice. Other than that, the vein closure time. VenaSeal, the vein is closed instantly. That is, when we do the procedure, within 3 minutes the vein is closed. In laser, after we do the procedure, we need to wear stockings continuously for long periods of time. The closure time can be weeks. Now, stockings. Now, another very essential part for our patients is, would I have to wear stockings or not? And with VenaSeal, the dependency on stockings is very less. If patients need concurrent sclerotherapy to be done during VenaSeal, then they would need stockings for some amount of time. But otherwise, if it's just straight veins and no sclerotherapy necessary, then we don't need stockings. With laser, stockings are compulsory, and that can extend to up to 6 months to a year. Return to activity. If a patient is otherwise healthy, post VenaSeal, they can return to activity almost immediately. With laser, it can be days or weeks, where it takes that much time for the patient to go along. Now, in India, there are also some special considerations. Both these devices are meant to be single-use devices. So medical, it's like an injection. You give an injection and throw it away. But due to cost constraints, laser gets rampantly reused, where it is re-sterilized and used again. This not only reduces the efficiency of laser, where we are, each time you sterilize it, the less amount of energy is delivered. It has also increased the chance of infection. But VenaSeal, it cannot be reused. It is like a pre-filled syringe where you inject it and finished it. So this also standardizes the procedure between all over the world. So our VenaSeal patients, can be assured that the same procedure, the same techniques, same materials which are used in the US or in Europe would be used for the patients, and that way it is more standardized across the world. That is what, these are the differences between the laser and VenaSeal.
That was quite a comprehensive information you gave us. We would love to see how the procedure of VenaSeal is done. Can you show us?
Yes, of course. I mean, I'm itching to show you the procedure. So we can see that the VenaSeal procedure, now in this animation, I'm going to describe as it goes. The VenaSeal procedure is done through an IV line. We can see that the pinprick IV line is given at the legs, and through that the VenaSeal device is guided right up, all the way up to the hip. Now this is done, when this is done, the patients typically don't feel it. The way the device is about 1.5 millimeter in diameter, and typically the varicose vein treatment veins are larger than that, so patients don't feel the device going through. When the device goes right up, when we reach up to the hip, we have to leave a certain distance from the saphenofemoral junction. After that, we remove the inner dilator, and then we introduce the primed VenaSeal microcatheter through the sheath. So this goes from the device inside, and when we reach there, we start injecting the VenaSeal by a specialized gun which is meant to inject VenaSeal inside the veins. When we inject this, for the first injection, we have to compress for about 3 minutes, and it is all done under ultrasound guidance. So we see what is happening. We do it as all done under ultrasound vision, and we see the veins closing right in front of our eyes. And as we do that, we keep withdrawing the catheter over set lengths and injecting the VenaSeal as we go along. This way, the VenaSeal is injected, and we compress for that amount of time right there, closing the vein right from the hip up to the ankles. So that is what, this is how we do the VenaSeal procedure.
Thank you for the detailed explanation. I would like to know, can you show us some cases which you have done?
Yes, of course. So first I would like to show you, in this particular case, you see that there's a large vein. On ultrasound, you see this big pipe-like vein, and in that, now immediately after the procedure on table, you see the next image over here where the vein is closed instantly. This kind of effect is very difficult to give from any other treatment. So this actually shows the sort of real-time closure of the vein that we see. Other than that, we have many special cases where we treat VenaSeal, and very special modifications of the procedure. So over here we see this lady with these large wounds on the legs, varicose ulcers at the calves, outside of the ankle and on the calf, and the skin darkening. So here we have actually modified the VenaSeal procedure, where we call it flip the device, where instead of treating from the ankle up, we treat it from the calf down, so that more of the vein is treated under the ulcer. And we reach right under the ulcer and deliver the VenaSeal under the ulcer to close the big bulging veins. And we see that, pre-procedure, this lady had these big wounds on the leg. This is a elderly lady, probably around 65, 66 years old. And we see in the 1 week follow-up, the wounds have started healing. And 1 month post-procedure, the wounds are completely healed. So this effect is giving such level of care to our patients without giving any sort of anesthesia is very rewarding for the VenaSeal operator. So another very interesting case, this kind of large dilated tortuous pericosities are very technically challenging to treat, and I'm very proud to say that we invented a procedure to treat these. And you see these pictures here, the before after pictures are a 2-month picture where it completely disappears. So what we have done here is it is a combination of a procedure, of the VenaSeal procedure along with sclerotherapy, and we call it plug and foam, where we plug the inflow of these veins into the GSP by the VenaSeal, and then we inject sclerotherapy in behind. So this is all done without any cuts or stitches, and absolutely amazing result. And these type of veins and the venous ulcers are which gives us most satisfaction to treat. And this is actually, patient was very happy, and you could actually see there's no signs of any residual veins behind. So that is what. So these are a few of the special cases that I wanted to show you.
Thank you for those cases. They're very interesting, and I really admire the way you have done these innovations. I'm sure it's commendable. What if I leave my varicose veins untreated?
So varicose veins, untreated varicose veins means that the blood continues to stagnate in the veins, and patients are at a higher risk of deep vein thrombosis. So we see patients who have been diagnosed with varicose veins, and they have to be immobilized for a long time, either by taking a long haul flight or drove for 8-9 hours continuously. So this kind of prolonged immobilization causes stagnation of blood in the veins, and then they become get a higher risk of developing a condition called deep vein thrombosis, and then this can worsen to cause pulmonary embolism and other such things.
Right. So what are the chances of recurrence in a varicose veins if treated by the VenaSeal treatment?
So various procedures have their various recurrence rates. Now with VenaSeal, the recurrence rates is least from what the current available methods are there, and this is it's under, I believe it's under 2%. Now recurrence from VenaSeal, from a patient's perspective, developing new varicose veins is also thought of as a recurrence, but when it comes from a operator's point of view, a recurrence means is the same vein opening up again. Now the same vein usually would not open up because it has a very less chance of opening. Other than that, varicose veins requires good follow-up. It's not like we did the procedure once and we let you go. All our patients get a regular scheduled ultrasounds where we check the patient again 7 days post procedure, 2 months post procedure, 6 months post procedure, once a year, once every 2 years, to look for any new veins that are developing. And if we find them early, we can just treat them by some sclerotherapy or a minor procedure where we don't wait until it worsens up and then needs a bigger procedure later.
That's great. Thank you, Dr. Saurabh, for letting us know about VenaSeal, which is a state-of-art treatment for varicose veins, and I'm sure all the patients will benefit from it. I have one last question for you. Is this treatment covered by Mediclaim or insurance?
Yes, of course. VenaSeal is a US FDA approved procedure, and it is covered in Mediclaim. If the patient has Mediclaim, of course they can claim for it. And typically varicose vein treatments, any sort of varicose vein treatments requires if it's a personal insurance, requires for the patient to have it running for at least 2 to 3 years. If it is a corporate insurance, then they can be covered straight away.
That's great. So thank you again for the detailed explanation about VenaSeal, which is a state-of-art treatment for varicose veins. And thank you so much for being here.
Thank you, madam. Thank you for coming here and asking these amazing questions. I would like to give a message to our viewers that please do not ignore varicose veins, and there are much more state-of-the-art procedures which can make the procedure pain-free. treated before it becomes a wound to live a happy and a pain-free life. Thank you.